All right. Hello, everyone. Today we're going to talk about nutrition-focused physical exams, or also known as NFPE. So what is NFPE? Nutrition-focused physical exams are performed by registered dietitians through the assessment portion of what we do. And the purpose of NFPE is to assess nutritional status and to help identify malnutrition. So during the exam, the dietitian looks for signs of nutrition deficiencies and malnutrition. And a few of us have actually done NFPEs on rotation this semester. And this is when you actually are putting your hands on the patient and looking for signs of malnutrition, checking out their GI, and just kind of getting, you already have the information about the patient that you get, the lab results, you get their diet history and all those things. But this isn't a chance to uncover things that maybe aren't written down on paper that you can find just being one-on-one with the patient and looking for signs of deficiencies and things like that. Okay, some areas to observe as part of the NFPE. Sometimes you're going to do a muscle or grip strength test with patients to assess malnutrition. You're going to look at their hands, their nails, their hair, their scalp, eyes, mouth, lips, tongue, cheeks. I mean, you're really looking at everything, and everything's going to tell you something. So we've learned in our Nutrition 101, you can look at hair and see, sometimes if there's an iron or zinc deficiency. You can look at eyes and see if there's a niacin deficiency. Same thing with hair, mouth, skin, lips. And deficiencies typically aren't going to be on the assessment paper that you get when you first get a consult for a patient. And these are things that you're only going to find by looking at the patient and their body and asking them the questions to uncover these types of things. So this is something that all of us got at Fancy this year. It's a NFPE pocketbook, and it is awesome. It's got all of the signs and symptoms. It's got a whole chart of, what to look for in the hair and what you find and what deficiency, what it means, what deficiency it is when the hair's dull. It tells you, from head to toe what you're looking for when you're doing the NFPE, and shows you the difference between, moderate, mild to severe malnutrition. So I definitely recommend getting this book. It's just a little tiny book, and you can actually, when I'm doing clinicals, I know when we're doing clinicals this summer, we probably will just carry this in our pocket.
Mm-hmm. I like how it has pictures too.
Yeah.
So things that we haven't seen before, we don't know what it looks like, but that pocketbook will give you a good descriptive and a picture to go with it.
Mm-hmm. Oh, and I don't think we introduced ourselves at the beginning of this video. This is Kelly Hayes and
Mackenzie McAllister.
Yeah, so we're excited to be teaching you all about NFPE. And NFPE is really like a new thing. Older dietitians really didn't perform NFPE, and even sometimes some of the hospitals that are kind of behind the times still don't do NFPE. But malnutrition is such an important thing to screen for, because if a patient leaves the hospital malnourished, 9 out of 10 times they're just going to end up back there in a few months. And so, that's, as a cost thing, Medicare, Medicaid, insurance companies, it costs them a lot more for the patient to continuously be in the hospital. And so it's really important to screen for malnutrition. Mm-hmm. And so that's why it's become very important practice for dietitians to learn. Okay, so we're going to show you guys a demo video of what an NFPE actually looks like. We're just going to skip through. So you see here, they actually, in some situations, you'll actually take vitals. So you'll take blood pressure, you'll take heart rate, you'll take the temperature of a patient. And so that's what they're doing here. We're going to skip to right here.
So I'm going to just start by looking here and doing your pressing your temples. And then if you can look up, I'm just checking to see the fatty pockets underneath your eyes. That looks good. And then we'll check your eyes. Perfect. And then if you could just smile at me. Good. And see your tongue. All right. Looks good. It's pink. Everything looks nice. And we'll just move over here. So right here, I'm just touching to make sure that your arms or your shoulders are rounded and not squared off. So that looks good. And then if you could just raise your arm up. And then your scapula back here. I feel just a little bit of protrusion, but not much. And your spine isn't too bad. Ribs are good. Put your arm down. So your skin looks nice from what I can see. Have you noticed any changes in your skin color pigmentation?
No, just getting wrinklier every day.
And your hair, have you noticed any hair loss or anything like that?
Yes, I have noticed that I have to clean my brush a little more often.
Okay.
And my husband always complains about the hair in the shower and says there's even more than normal now. So I guess
So he's been noticing a little bit too. Okay. Well, it looks nice. Not too dry or brown or anything, so that's not a major concern. Let's see. I'm gonna just feel your thigh right here, and then your knee, and that's the same thing. Just making sure it's not squared off, and that's nice. And then checking for any edema, which I don't see. And can you make an okay sign? This is just another fatty pocket that we like to check for. It looks pretty good, and your nails nice, and you have good capillary refill. So let's see. Next, we can do your respiratory breath sounds. See how that is. And just take a deep breath. One more. Okay, sounds good. And if you could, we'll do your abdomen sounds next. Sorry, let me get my things out of your way. Okay. So can you put your hands to the side? Okay. Okay. Alrighty. Everything sounds nice. Alright, so good. Okay. Let's see. So I calculated your BMI, and it is about 18, and so that's in the low range for you, and that could be attributed to why your wrist isn't healing as.
And that was for an anorexic patient, but that the NFPE is still the same. You know, you're still checking and looking at the same things.
Okay. Yeah. So like Mackenzie said, you know, that was for anorexic patient, but it's the same assessment with everybody. You're just looking for different things. So we are going to do a case study, and this is our patient. They're a binge eating disorder patient. And so this is their present medical history. And this is things that you're going to get before you go into the NFPE sometimes. Sometimes you won't get it, but most of the time you're going to get information before you're going in. And so these are the things you want to take notes of. And so when you go into the NFPE, you have an idea of what you're looking for. And so our patient is a 45-year-old woman that presents for treatment of binge eating disorder and weight loss. Patient has been a special education teacher for 11 years and a mother of 2 children. She reported maintaining a weight of approximately 150 pounds with a BMI of 25.7 until the age of 28. And at that age, she became pregnant with her second child. She reported that she never fully lost the baby weight and slowly began to gain weight over the next 10 years, even with inconsistent dieting. She reported a rapid weight gain of approximately 25 pounds within the past 6 months. And then it's also important to note that the patient was a caregiver for her mother, and the time following her mother's death was emotionally difficult. And so the patient claimed that her binge eating increased from 3 to 4 times per week during her mother's illness to 6 to 7 times per week following her mother's death. So those are important things to note too, because it gives you the etiology behind, kind of why this is happening.
Mm-hmm.
So these are her anthropometrics. She's 230 pounds, 5'4", current BMI is 39.6. Her weight 6 months ago was 205 pounds, and she's 112% above her usual body weight. And her lowest adult weight was 150 pounds, and her waist to hip ratio is 0.86. So these are some current medications and supplements that she's on. And these are important to take into consideration too, because you want to know the maybe symptoms of these medicines. So Linzapril and Lipitor can cause GI comfort. And so going into the
Discomfort.
GI discomfort.
Yeah, you said comfort.
Oh, discomfort.
Sorry.
Whoops.
Just
Y'all know
wanted
what
to
I meant.
clarify.
Yeah, they can cause GI discomfort. And so that may be something, remember in the NFPE demo, Mackenzie listened to Kaylee's GI.
Yeah.
And so that may be something that you're going to spend a little extra time and ask a little bit more questions about to see if she is either constipated or having diarrhea or something like that. So this is her lab values, and these are going to be really important too, because sometimes the lab values will tell you if the medication is messing with one of her labs. So I know with Linzapril, it can affect potassium and sodium levels. So those are maybe some labs that you want to look at. And, if her sodium levels are off, then it's going to be important when you go down to her ankle to check if there's any edema present.
Mm-hmm.
So these are the things that you kind of have to start thinking about when you go into your NFPE and making kind of mental notes or notes on paper for.
Mm-hmm.
So typical daily intake, and so this is something before you start the actual touching the patient, that you're probably going to ask again, even if you have this information going in. You want to ask the patient again, what is their typical daily intake? And that can tell you a lot. So you see with her, it's kind of a typical binge eating patient's diet. They eat pretty normally throughout the day, probably skipping a meal, and then at night they're just binging on a lot of food, 2,000 calories. So that's pretty significant. Estimated calorie intake with binge episodes, about 4,000 calories per day, and she is sedentary, so it's no wonder she gained so much weight. And here's some comparative standards. So healthy BMI range in those under 65 is 18.5 to 25. And this is her different metrics for her height. So, sometimes your hospital system may be having you chart in inches, some centimeters, sometimes meters. It just kind of depends. So it's good to know the conversions for those. And then also be able to calculate the BMI with that. Okay, more comparative standards. So you also want to know what her estimated energy needs are. And Mifflin St. George is often the most common formula used for that. And so her estimated needs are 2,015 calories per day to maintain her current weight. So she's eating twice that much.
Mm-hmm.
She needs about 0.8 to 1.2 protein needs for her protein needs. And so that's about 84 grams per day. And her fluid needs are 2 liters per day. And so these are things when you're actually filling out your consult that you definitely are going to have to fill out. I was just at the state hospital and we did paper charting, and every patient that came through that we did a consult on, we calculated their protein needs. We calculated their energy needs, their daily energy needs using the Mifflin St. George. We calculated their fluid needs. And so these are things that you also, with your NFPE book, you want to keep in handy. as far as like fluid needs for age, because it does differ, and the BMI. And it's just good, even if you know this stuff by heart, if you're having a rough day and there's a lot of stuff going on, sometimes it's nice to just have it there with you to reference, because sometimes you can lose your mind.
Right. And like the comparative standards, knowing those and having that, implemented in your brain every day, whenever you go do, NFPE with a patient, you can know right off the bat what's wrong. It's a puzzle piece, but you're putting all the puzzle pieces together. So when you know these comparative standards, which in school it kind of seems, just repetitive.
Like a memorization thing.
Yeah, but you really will put it together.
Yes, it's very important in real life, because this is literally you as the medical professional. You're really the only person who is logging this kind of stuff in their medical records. So it's very important. So again, after looking at the assessment portion of your patient, this is all their history and stuff. This is the things that you need to be thinking about. What am I going to look for during this NFPE for binge eating patient, knowing what I know now about this patient? And so when I was thinking, I'm going to be looking at their hair, their eyes, their face, their mouth, lips, tongue, gums, and teeth, nails, and skin, because that's going to tell me if she is nutrient deficient. Looking at her diet, she's, binge eating patients aren't binging on fruits and vegetables. They're binging on junk food. And so looking at her diet, she's not eating very many fruits and vegetables. And so it's very possible, even though she is overweight, that she can be malnourished and deficient in nutrients.
Right. And, too, there's, without eating a lot of fruits and vegetables, the fiber can be pretty low, that fiber intake, and that can also cause her to have some GI discomfort along with the medication she's taking. So that's another thing that, you want to put together and ask questions about.
Right. And I do want to note too, NFPE, especially in that video, a big part of it is actually touching the patient. But sometimes, and in certain hospitals, like I said, some are behind the times. You won't actually get the chance to touch the patient and do the full NFPE workup. But what you can do, going in and talking to the patient, NFPE starts as soon as you walk into the room. You're looking at the patient's hair, you're looking at their eyes. You don't have to touch them to look at these things. And so even while you're talking to them, you can get a glimpse of their lips, their mouth, their tongue, gums, and teeth. And you're doing NFPE without them even noticing. So that's really important to remember too.
Right.
Okay, so here's some PES statement examples, and we gave you guys 2 examples. So for this binge eating patient, excessive energy intake related to binge eating episodes as evidenced by patient's self-reported binge eating patterns, food recall, estimated daily intake of 4,000 calories per day, and a BMI of 39.6. Another one could be undesirable food choices related to binge eating disorder as evidenced by diet history or patient's self-reported diet history, BMI of 39.6, and oops, that's supposed to be 25, not 725 pounds, but 25 pounds of weight gain in the past 6 months. And so we provided you, Mackenzie, you want to talk about the...
Yes. So I scanned some papers for y'all to have online, but best practices in regards to PES statements. So it just kind of talks through the assessment, diagnosis, intervention, and then monitoring and evaluation. There's 4 steps in the NCP process. So I did include those, and those are great resources. We just got those the other day in our PES statement workshop. So
yeah, so
utilize those for sure.
Yeah, so these documents should be attached in the Blackboard tab with this this presentation, and definitely keep everything. Keep everything. I'm sure Ms. Meek has told you guys this, but these are the types of resources that when you're going through an internship or even when you're on rotation, I was writing PES statements at the state hospital, and it's it's a really good way to impress your preceptor and kind of have a leg up on other interns if you can write good PES statements.
Mm-hmm.
And so your homework, I guess, or activity for this presentation is to make your own PES statement based upon what you may have found during an NFPE with this binge eating patient. And so think about everything that we talked about and think about things that you may find on this patient if you did an NFPE.
Mm-hmm.
And you can kind of, make it up. Maybe she's losing hair. Maybe she has cracks around her lips. What does that
Mm-hmm.
mean? And use your diagnostic PES terminology. I believe all of you have that. So,
and just make sure you're clear and concise. And PES statements don't have to be complicated. The more, simple they are, sometimes the more likely the doctor is going to read that.
Right. And, you want to think about it as something to like that you can fix as the dietitian. You're not going to write a PES statement putting them on Vyvanse, because the Vyvanse is typically a medication for eating disorder patients, especially if they're eating too much. But you as the dietitian can't actually prescribe a medication like that.
Mm-hmm.
So you have to make sure that your PES statements are based around things that you as the dietitian can help this patient with. And so that's really going to focus on intake, eating patterns, things like that. All right, so medical nutrition therapy, just kind of talking about what you would do for a binge eating patient. And these two are also things that, this is the medical nutrition therapy. These are the things you're going to be writing PES statements about. So self-monitoring and record keeping of food journals, normalizing eating patterns, setting realistic goals for physical activity, weight loss, and weekly meetings with the RDN, and maintaining changes and preventing relapse.
Mm-hmm. Yeah, and I will say before we close this session, with a binge eating disorder patient, this is the time where, as a future dietitian, you have to think about when it is the right time to outsource and think of other healthcare professionals that this patient may need, because you as a dietitian alone can't help and solve all of their issues, just like a counselor can't solve all their issues. It's a team, and that's the interprofessional relationship that you need to have. And so, as a dietitian, outsourcing with these types of patients is something we need to consider.
And that's also part of the whole ADIME process. So the intervention piece of the ADIME, it a lot of times includes referring this patient to a counselor or a psychologist, because a lot of times, especially with eating disorder patients, like that is definitely part of their entire care plan.
Mm-hmm.
And this is, everybody says, you want to have your seat at the table as a dietitian. Well, part of that is, being a catalyst, or what am I trying to say? Being a communication line for this patient,
yes.
and helping steer them in the correct direction as far as what
right.
therapy that they need,
and advocating for that need.
Mm-hmm. Okay. So some typical recommendations for a binge eating patient and our prescription drug therapy. So Vyvanse, SSRIs, appetite suppressants, there's supplements, and of course the main goal is to break the binge eating cycle. Should be achieved before even addressing weight loss. And so the ultimate goal is self-acceptance, increased physical activity, improved overall nutrition. And again, these are things that you want to keep in mind as a dietitian. So when you're writing your PES statement, you want to keep in mind that breaking the binge eating cycle should be achieved before addressing the weight loss. So you, off the bat, maybe later down the line, when you've been seeing this patient and they're making significant changes, then maybe it's appropriate to start addressing weight loss.
Mm-hmm.
But you got to make sure that you are assessing that situation correctly and it's the right time for that.
Right.
So off the bat, you wouldn't want to make a PES statement saying overweight and, making this huge intervention for them to lose weight, because that just wouldn't be smart. Okay, that concludes the presentation. If you guys have any questions, you can, I guess, email Miss Meek or
Which she can give you our emails too. We'd be happy to help.
yes, and yeah, if you guys have any questions about PES statements, we literally just did a PES statement workshop, so we're all really fresh on that type of thing, and practice PES statements, and even with different patients, thinking about practice NFPE. I know we were meant to do this in class and we were going to have everybody practice NFPE on each other, but maybe practice on your friend or whoever you're social distancing with. It really gives you a leg up if you know how to do NFPE, especially before going into the internship, because last semester we focused a lot on NFPE.
We were doing it like every week.
Yeah. So. And like I said, a lot of us have done NFPE on our rotations. And I know Jordan in particular, his preceptor was very impressed with him because he was comfortable doing NFPE and knew how to do it. So just very important. So thank you guys so much for watching. I hope that this helps. And yeah, that's it.
Thank you.
Thank you.